The broadcast is now starting. All attendees are in listen-only mode.
Hi, I'm Deborah Jamison. I'm an epidemiologist with the Durham County Department of Public Health. And first, I just want to thank you all so much for volunteering to be part of our health assessment process. We really couldn't do this work without you, so thank you for signing up to volunteer with us. Today, I want to go over some of the basic information that you'll need to know in order to be successful on the day that you come out and volunteer with us. So we'll cover a little bit about what the community health assessment is, and part of that being the survey, but there's some other components that are part of that larger process that I'll talk about. And then we'll talk about more specifically how the survey was sampled and some of the other methodologies. We'll talk about the logistics and best practices for interviewing when you're out in the neighborhoods. And then we will also talk about how you record the survey data in the tablet and software that we'll be using on the day that you survey with us. So to start off, we'll talk a little bit about what the community health assessment is. We do the community health assessment at the Durham County Department of Public Health in collaboration with Duke University Hospital System every 3 years. And we do it for a variety of reasons. One of those being that it helps us keep a pulse on what's happening in the community. So doing the survey in particular gives us an opportunity to go talk to people more extensively about things that we might not talk about just at the health department. So we talk about a variety of issues like health and housing. We talk about some of the more traditional things that we might talk about here, like tobacco use, but we also talk about transportation. So there's a variety of different things on the survey that we can get more in-depth information on when we're out in the community. This also gives us an opportunity to hear directly from community residents, and it helps us identify the top issues that we need to be working on here at the health department. So related to that, the data that we get from the survey and from the focus groups that happen after the survey give us a lot of direction in terms of what we're working on at the health department. It gives direction to Duke Health Systems, and it also gives direction to the Partnership for Healthy Durham. And if you're not familiar with the partnership, I encourage you to take a look at their website at healthydurham.org. Healthydurham.org has information on some of the work groups that are created around the top priorities that come out of the health assessment. And during the last cycle, those were health and housing, access to care, poverty, mental health, and obesity, and diabetes and food access. So there's a work group surrounding each of those issues with the exception of poverty, and that's because there's already a number of groups that are working on poverty-related issues, and we don't want to take resources away from those groups or people. So if you're interested in learning what we're doing to combat those issues, or if you're interested in becoming part of the Partnership for Healthy Durham, I encourage you to take a look at the website. And again, that's healthydurham.org. We also do the health assessment because we're required to at the health department as part of our state accreditation process, and Duke Health is also required to do a health assessment since they're a nonprofit hospital. So we collaborate together because it pools our resources together, and it also takes a burden off of the community by us just doing one health assessment together. And in 2017, we were really excited because we were awarded an award of excellence for the health assessment process that we completed. And what the people said that gave us the award was that they were really impressed with the how collaborative our process was. So just as an example, the final report that we put out is over 500 pages, and it includes 14 chapters. There was over 90 writers who contributed to the report. Some of those people are from the health department, some of them were from Duke Health, and a lot of them were from community partner agencies. So that really enriches the document because it provides content expertise that we don't have just at the health department or just at Duke Health. So that's a special thanks to anyone who participated or helped in the last health assessment. And hopefully we can do just as good of a job this year. Here you can kind of see an overview of the entire process. So obviously before we collect data, we have to develop a survey tool. So that's what we start off doing. And I started that process in January. And with that, we develop a team of people who meets together. We look at the old survey tool and think about which questions we want to ask again. But then we also think about where there's kind of gaps in the information that we're learning. So as an example, in the 2016 survey, we only asked one question about housing and health, But since that was the #1 priority identified by community residents, we felt that we needed more information around that topic. So we included several other questions this time. So that's just an example of how we change and adapt the survey in order to meet our needs. And the purpose of collaborating across agencies on the survey is so that we are collecting data that's useful not only to us at the health department, but also to Duke and to our other community partners, so that we don't need to do 10 surveys, for example. We're getting the information we need just in this one. So after the survey tool is developed, I draw the sample, and I'll give a little bit more information about how that happens later on. And then we enter this third block, which is what we're about to start now, which is collecting primary data via the survey tool. Then after the survey data is collected, I will analyze, interpret it. I present it back to community members at a series of listening sessions. And at those sessions, community members have an opportunity to provide their input on what's being presented. So they can provide context around what's being presented, or they can add things that they think that maybe weren't collected in the data but are missing. And that's a really important aspect, because we'll get to this when I talk about how the sample is drawn, but only households that are randomly selected are eligible to participate in that survey. So we want to make sure that everybody has an opportunity to participate in this survey. I mean, in the data collection process, and the listening sessions are an important part of that, because those are open to all residents. So then we take the data from the survey and from the listening sessions, and we use those to determine our health priorities. Then we create the health assessment document, we disseminate the report, we create action plans, and that usually happens under coordination of the Partnership for a Healthy Durham. We implement those action plans and start evaluating our work. And then in the in-between years, when we're not creating one of those really big 500-page reports, we push out smaller 10 to 12 executive reports that we call State of the County Health reports, so SOCH reports at that last box down there. And those just give kind of brief updates with where we're at on the priority areas. So this is kind of what the health assessment process looks like from start to finish. Okay, so now I want to tell you a little bit more about the specific methodology for the survey that you'll be helping with. We do a door-to-door survey, and we usually get a lot of questions about this, and in particular, people are interested in knowing why we don't do an online survey or a mail or phone survey. So part of the reason is that a door-to-door survey is accessible to everybody. We are not requiring somebody to read information or to write down their responses. So literacy can still be an issue, obviously, even when we're reading responses, depending on the types of words that we're using. But we write it at a low enough literacy level that it's accessible to most people. And then again, it's not requiring somebody to read that information directly or to record their responses. And when you think about it, an online survey would require somebody to have access to the internet, which may not always be the case. So that can be less accessible. And then phone interviews used to be a really popular choice, but as cell phones have taken over and people tend to not have landlines, it's become increasingly difficult to use phones as a survey methodology when you're surveying by a geographic location, because somebody could have a cell phone that's tied to New Jersey or New York but be living in Durham. So it's a little bit harder to survey that way. So those are some of the reasons that we do a door-to-door survey. We also think the data quality is a little bit higher this way. We have the ability to provide clarification on questions and wording, and we'll go over specifically how to do that later on. And we also tend to get a higher response rate. I mentioned earlier that the survey development process is very collaborative. This year, there's under 60 questions. We have 2 different surveys, and I'll talk about that in just a minute. But on one of them, there's a couple more questions than the other. We based the types of questions that we included based on input from experts in each content area. And we also made sure that we're only collecting data and asking questions that are leading to action. So we didn't want to collect data or information that we're not going to do anything with. Okay, as far as our survey methodology goes, I won't go into too much detail here, but if anyone's interested in more details around this, please email me and I would be happy to tell you more. But generally what I do is I do a 2-stage cluster sample. So I start off by randomly selecting census blocks to participate in, or to participate in the survey, and those are selected based on the number of households that live in those census blocks. So what that means is that really highly populated census blocks are more likely to be selected into the sample rather than more rural census blocks. And then after the census blocks are selected, I randomly select households within each of those census blocks to participate. So that's the process for the county-wide sample. So in that one, any household that's in Durham County could have been randomly selected to participate. But I also do a sample just for our Latinx and Hispanic residents. And to participate in that survey, we start off by looking at just census blocks where there's 50% or more Hispanic and Latinx residents living in those census blocks. And then from those, I randomly draw households to participate or address locations. And then, of course, you have to be Latinx or Hispanic to participate in that survey. So it's probably obvious by the way that I just described those that we're not talking to everybody in the entire county when we do this survey. We're just talking to a subset of people. That said, we are talking to a pretty large number of people. So in the county-wide sample, there will be 525 households who are selected to participate. And in the Latinx sample, there's 235 households. And without getting too detailed about what goes into calculating sample size, the basic idea is that we need a higher number of households in the countywide sample so that we can break down our data by race and ethnicity, and we don't have to have quite that same number of households in order to look at data for our Latinx sample. But again, if anyone's interested in more detail, you can feel free to email me and I'd be happy to explain that more. Okay, so that's the basic about the survey methodology. Now I want to get into some of the expectations and protocol for the day of the survey. So the first thing is just some basic safety tips. The number one thing that we want people to remember is that your safety always comes first. So if you feel uncomfortable in a situation when you're surveying or about to go survey, always prioritize your safety over collecting the data. And I'm going to go over a few safety tips to help you do that now. These are probably mostly common sense, but it's just a good reminder. So number one, make sure that you're driving safely. So the way that we do the survey is we pair people into partners. And generally people like to carpool as they're driving out into the neighborhoods that they've been assigned to. So if you're the person driving, please don't navigate using your phone. Let the person sitting next to you, your partner, help you navigate so that you can make sure that you're paying attention to the road and driving as safely as you can. Also stay in uniform. So you can see here this picture. This is Laura, one of the volunteers who helped us in 2016, and you can see she's wearing a blue survey team t-shirt. This is the same t-shirt that we'll be using this year, and we'll be giving these t-shirts out on the day that you come volunteer. So we'll ask everybody to put the t-shirt on and keep it on for the entire time that you're out surveying. And that helps community members identify you. We've also put this information out in the press releases and into the neighborhood listservs. So anybody who's been exposed to those advertisements or press releases will be expecting to see people in these blue t-shirts. Also, if you have a badge, for example, if you work at the Durham County Department of Public Health, make sure that you wear that at all times. If you don't have one, that's okay too, but this is just another way that you can help kind of show your credibility if someone is questioning why you're at the door. And then make sure that you're checking your cell phone throughout the day. So on the day that you volunteer, I'll ask you or your partner, or you both can if you want to give me your cell phone number so that I can check in with you and make sure that you're okay. So I like to hear from people a few times throughout the day just to make sure that there's no issues going on. Okay. Some more safety tips. Always observe the area that you're about to survey before you get out of the car. So you can look for unleashed dogs running around, and if you've already gotten out of the car, you also want to look for dogs inside of a fence if you have to open up a fence to get to the door to be able to knock or ring the doorbell. If there's a fence but you don't see a dog, and especially if the fence wraps around the back of the house, it can be really helpful just to kind of tap on the fence or knock on the fence a little bit, jiggle it, and if there's a dog, usually that will kind of stir them, and now you'll know whether or not there's a dog there, and you can make a decision about if you feel that it's safe for you to go any further or not. Remember that it's always okay to leave if you feel uncomfortable in any situation. So that means before the interview, during the interview, at any point, if you feel uncomfortable, you and your teammate can have some kind of signal or something worked out beforehand so that you're both on the same page about whether or not somebody needs to leave. Whenever possible, complete an interview outside of the home. This isn't always something that can be done, especially if it is particularly hot on one day, or if you're interviewing an older adult who needs to be sitting down or needs to be in the air condition. And you can use your discretion to decide whether or not you feel comfortable entering someone's home. If the person needs to be in their home to be interviewed and you don't feel comfortable doing that, you can just make a note of it on the tracking sheet, which I'll show you in a few minutes, and somebody else can come interview. But you don't have to go inside someone's home if you don't want to. You should never use a restroom at someone's house. Always wait to find a public restroom. So you will be out all day and you probably will need to use the restroom at some point, but you can look for gas stations or go to a coffee shop. You can come back to the base station, use the restroom there, but don't ever use a restroom at someone's house because then your partner is left alone and you're also alone at another place in the house. We also don't want you accepting food or drinks from anybody who you're interviewing. We will be providing you with lunch and water. If you need other snacks to get through the day, please bring those with you, but don't accept food or drinks. This is a safety issue. And then also, we just don't want to be asking residents to provide us with the food and drinks that it takes to get us throughout the day. And then another probably basic thing that you already know is to never split up from your partner. So this can mean inside the house. It can mean if you forget something in the car, don't send your partner back to go get that alone. Stay together. If you need to go back to the car, go back together. The only time it's probably okay to split up is if you're in a public area and you're eating lunch and you need a little bit of alone time then. But other than that, make sure that you're together for the whole day. We also want to cover a few quick safety tips about the data and the tablets that you'll be using. Make sure you keep your tablet with you at all times. Don't ever leave the equipment in your car, and if you do leave it in your car, especially don't leave it on the dashboard. So at lunchtime, if you want to leave the tablet in the car, I would say you should put it in the trunk where it's less likely to be overheated and it's not in plain sight. We also want to make sure that we're keeping the data secure. So if you're not entering data actively into the tablet, you need to lock it when it's not in use. And I can show you how to do that when you check in on the day that you're volunteering. This is really important because it helps maintain the confidentiality of the responses because there is some sensitive information that we're collecting in the survey. Okay, so now we'll cover some quick things on what you should do if you encounter one of these signs while you're surveying. If you encounter signs that say no soliciting, no exceptions, and this is probably most likely to happen if you're surveying in an apartment complex or a condo complex, it's okay to proceed and go to the household that you've been instructed to go to. So it's not considered soliciting if you're surveying. This isn't actually even considered research. It's as part of the public good. So it's not considered soliciting. You should continue on and try to survey, but if you're asked not to return to somebody's house, then you obviously don't do that. If you see a sign like this, private property, no soliciting, no loitering, no trespassing, you can use your discretion on whether or not you feel safe to continue on. I would say that if you're going down a dirt road and this is posted, you can decide if you feel comfortable or not. I probably wouldn't continue down that dirt road, especially if it's a long ways off of the main road. But if you see this and it's in an apartment complex, it's not considered trespassing to survey somebody. So the way that the law works is that you're not trespassing unless you've been asked to leave specifically. So if you go knock on the door and someone tells you, please leave, you're trespassing, then at that point you would need to leave. And if you don't, you could be prosecuted for trespassing. But until you've been told to leave, it's not considered trespassing. No soliciting, again, we've covered this up above. It's not considered soliciting to ask somebody to take a survey for the public health department. No trespassing, again, this is just a different way that the sign might look, and another no trespassing sign. So basically use your discretion, but just remember that you're not trespassing or soliciting, and it's okay to knock on someone's door until you've been told not to come back. And then you should note that in the tracking form, which I'll show you in just a few minutes. Okay, a few things to keep in mind about you and your role as an interviewer. So if you think about an interviewer coming to your house and asking to take some of your time to complete a survey, and especially one like the one that we'll be doing, which is a little bit lengthy, there's a lot of competing activities that you could be doing. You could be, if you're working from home, you could be working. If you are getting ready to go work, you could be doing that. You could be running, you could be watching TV. So there's a lot of those competing activities that we're having to overcome in order to get someone to do a survey. There also could be embarrassment about some of the survey topics. Some people might just not like the interview topics at all, or there could be a fear of consequences by participating. And this is probably especially true for people who don't trust the confidentiality of the survey. But kind of balancing against that is the prestige of doing research, and this actually isn't considered research, it's just kind of quality improvement. With the health department, there's the perceived importance of the topic. There's the rapport that you build with the resident when you knock on the door and introduce yourself as a good self-image as a dutiful resident. Some people might feel lonely and would be interested in participating in the survey because of that. So you want to kind of draw on those reasons and use that to balance out the other competing reasons that people have for not wanting to participate in an interview. And this is just important to keep in mind when you're thinking about how you introduce yourself and how you're introducing the survey topic. Okay, so when you approach a door, you want to make sure that you maintain a comfortable distance. So generally you want to knock and then step back. Don't stay really close to the door because that can feel intimidating to the person when they open it up. Also, usually you want to stay on the stoop rather than, if there is a stoop, rather than going back down the stairs. And we always say that you should try to knock 2 or 3 times. So this person is not expecting you to knock on their door. So they could be cooking, they might be getting ready, they might have just gotten out of the shower. You need to give them a few minutes to get ready and have time to come down and answer the door. So knock once, wait maybe 30 seconds, knock again, wait another 30 seconds, and then try a 3rd time. And then also remember with doorbells that not all doorbells work. So if you don't hear it ring, maybe try knocking after that. With gates, if the gate is not locked, you can use your discretion on whether or not it's appropriate to enter the gate in order to get to the door. Same thing with screened porches. If there's a lot of personal items in the porch, like a couch, and it seems like a living space that's more like inside the house than outside, use your discretion on whether or not it's appropriate to enter the porch in order to knock on the door. And then also look for doorbells that might be outside of the porch. Another alternative would be to look for a door that you can access without going through the screened porch. And then finally, pay attention to whether you're knocking on the front or back door. So this can be confusing, especially for houses that might have a side door. Always make sure that you're knocking on the front door if there's an obvious front door, because that's where people expect people to come. Okay. When you're doing your introductions, make sure that you always make eye contact with somebody. Smile, introduce yourself. Don't read from the script. You should have the basics of what you want to say memorized. Keep it brief and try to relate to the person. So you don't want to make up compliments or be cheesy, but if you like the flowers or the garden that they have, you can give them a compliment to kind of build some initial rapport before you start introducing the survey. So an example introduction of what I might say if I was knocking on someone's door is, "Hi, I'm Denver. I work with the Durham County Department of Public Health. We are doing a random sample of surveys and your household was randomly selected. We're using the responses from the survey to help us prioritize what we work on at the health department. And I'm wondering if you'd be willing to participate in the survey. It'll probably take about 20 minutes." So you can say something like that. Remember to stress that it's confidential. We're not going to be collecting names or addresses at all. Also, with regard to confidentiality, after you've wrapped up the interview, don't discuss the interview details or the address with anybody else. Okay, so now we'll cover a few interview techniques. When you're interviewing, you should be all ears. So the main thing that you're doing other than asking the questions is listening. We want to be neutral. So if somebody says something, we don't want to be like, "Oh, that's awesome." Use neutral terms. If we use things that reinforce certain responses, then we start introducing survey bias into the responses. That said, it's also important to be accepting and compassionate when it's appropriate. So if you've asked a question, especially if it's an open-ended question or something like that, and someone tells you about a traumatic experience they've had, then you can say something like, "I can understand that," or "I'm sorry you've experienced that," but we generally want to stay away from having conversations about the responses someone's given unless it feels inappropriate not to acknowledge something that they've just told you. Okay, a few other notes, and these are probably really self-explanatory and obvious, but just want to make sure that we're all on the same page. We all need to be asking questions exactly as they're written. This is really important because if I take my own spin on a question and somebody else takes their own spin and someone else takes their own spin, then we've just created 3 different questions and we're getting 3 different types of answers. So we don't want to introduce that bias into the survey. These questions were all written with a lot of intention, and we want to ask them exactly as they're written. If the person being interviewed needs clarification, we'll cover in a few minutes how to do that because there's some specific ways that we can do that to maintain neutrality. We also want to ask the questions in the order that they're written. So if you start skipping around from question to question, it will mess up the skip pattern. Some questions are skipped based on answers that people give. You also want to ask every single question that's specified on the survey unless it tells you that you should skip a question because of the response that they just gave you. And then finally, we want to record the responses accurately. So if somebody is giving an open-ended response, it might not always be possible to write down verbatim what they've said, but try to use as many of their words as you can rather than paraphrasing what they've said. Okay. A few other things when you are interviewing someone, if there's not a response right away, just pause and wait for a response. People don't like a silence, so if you kind of just let the silence fill the room, they're going to fill in the blank with a response. If they don't, you can repeat the question. You can also repeat the question if they ask you to, or if they look confused. If you need to, you can clarify the question when it's appropriate, but be mindful that you're not influencing the responses by putting your own spin on the question, because that introduces survey bias. So before clarifying, the rule of thumb is to always repeat the question first and see if repeating the question clarifies it by itself. If it doesn't, then you can try to simplify some of the words that are used in the language of the survey, but try not to ask it in an entirely different way. So just as an example of how a question can be reworded in a way that's not good and in a way that's good, we'll look at this one. So this is a question that's included on the survey we're going to be giving. It says, "How often do you get the social and emotional support you need?" So if you've asked this question and the person being interviewed is confused and they need clarification, what we would not want to do is ask it like this: "Do you feel like you usually get the social and emotional support you need?" We've just created a leading question because we're saying, do you usually get it? So rather than a Likert scale, we've made this a yes or no question. So don't do that. What I would do in this situation is there's actually some script that's included that you can use for clarification if the person needs it. So I would provide that first. So I would say, how often do you get the social and emotional support you need? Please include support from any source. If they still don't understand it, then you can use slightly different words. So you could say, do you feel like you get the social and emotional support you need? And then you could use the answer choices that were given, which I think are something like always, usually, sometimes, rarely, or never, to kind of help them along with an answer. But try not to give a leading question. A few more, always practice active listening. So if the person's not responding, be sure that you're paying attention to the nonverbal cues. Do they look confused? Are they tired? Are they becoming disinterested? You can use what you're noticing about their body language to help you complete the interview. It's also really helpful sometimes to repeat the participant's reply, especially for open-ended questions, to make sure that you're understanding what to write down if you can't write down the full thing that they told you. Another time when this might be helpful is if there's a Likert scale, and maybe it includes something like strongly agree to strongly disagree. So if someone says, yeah, I think so, you would need to ask them, so would that be a strongly agree or agree? You would never want to assume what they mean by that. You can also probe when it's necessary. So probing is a neutral way to get clarification on an answer when the respondent's answer is unclear or irrelevant. Sometimes you can repeat the question. You can ask, what do you mean? If this respondent has narrowed down the answer to a few choices, but they haven't been able to pick a single choice and they need to, then you can ask things like, which would be closer? Or if you had to choose, which one would you pick? We want to make sure that we're not ever making the participant feel like we're cross-examining or grilling them, though. So if they can't provide an answer, it's okay to probe maybe once and ask some clarifying questions to them to help them get to an answer. But if you can tell that they're having a lot of trouble, or that you feel like they don't want to answer, that's okay. There's a I don't want to respond option to every single question, and that's okay to choose too. Then at the end of the survey, we'll be giving out incentive bags. This isn't exactly what our bags look like, but the bags will have a water bottle and some informational resources that they can use, like a 2-on-1 card, a state of the county health report, and a few other things. And that's just as our thank you for their time. Okay, we're almost done with this section. So a few more things before we practice with the surveys. This will help you as the person recording the information, or as the person who is asking the questions to the participant. If you see a circle on the answer choices, that means that you can only choose one answer for that particular question. And it'll also tell you after the question, it'll give you directions about how many answer choices you can make, but this is just a visual cue that you can use too. If you see a box, it means that you can choose more than one answer. But you still need to read the directions, because sometimes there's a specified number, like you might only be able to choose 3, and sometimes it's choose all that apply. If you see text in red italics, that means you should not read that out loud. If you see that there's an other response or an open-ended question, just be looking for the prompt where you'll be able to write in what they've said, because there's always an opportunity for you to write in some clarification on what they've said. And then finally, skip patterns are written in red text. And so as the person asking the questions, you'll see based on their response if you need to skip to another question or skip over some questions. If you're the person recording the responses in the tablet, those skip patterns are automated. So it'll automatically skip the questions that you shouldn't be recording information for. Okay, so now it would be useful for you to practice interviewing using the survey tool that you're going to use on the day that you're surveying. So if you're surveying in English, use the English survey tool, and if you're surveying in Spanish, use the Spanish survey tool. And if you're listening to this webinar with a partner, then it would be really helpful for you to practice interviewing each other. Maybe one of you can do the first half and the other one can do the second half. If you're doing it by yourself and you don't have someone to practice with, then maybe just try doing the survey on your own. So the other thing we want you to do, no matter if you're with a partner or not, is practice your introduction a few times so that you have it down and you're really comfortable with it. So take about 20 or 25 minutes to do this activity, press pause now, and then restart after you've done that. Okay, now I want to talk to you briefly about the survey materials that you will be getting on the day that you volunteer. Every partner team will get a binder with questionnaires in it. So there'll be a questionnaire for the person who's reading the questions. There'll also be some questionnaires that you can use to record the responses in case the tablet malfunctions. And then there's also going to be a follow-along survey for the participant. And that one will be different. That's a different version than what you'll have. So just as an example, you can see right here on the screen that there's some red text with interviewer notes. So the participant copy wouldn't have that red text there. You'll also have some field maps. You can see on the left, this is the field map with all of the clusters that we're going to for the Latinx and Hispanic sample. And then on the right, you can see the map with all of the clusters that we'll be going to for the county-wide sample. Your team won't be going to all of these clusters. You're going to be assigned some specific clusters. So you'll have maps of the specific clusters you're going to. This is an example of one of them. So it shows you the exact block that you're going to, and where there's dots on the houses, those are the houses that you're going to. And I actually haven't finalized this on the final version. It'll say like 1-1, 1-2, 1-3, etc. on each of these points. They'll be labeled, and that's how you'll know kind of what address is associated with that house. But this is just kind of an example of what it kind of looks like. You're also going to have a point list. So here you have the map of all the houses. Here you have the address list of all the houses. So that's what I was talking about with the 1-1. There would be a 1-1 written on one of these points, 1-2, etc. So here you have the address, the city, the zip, and the longitude and latitude if you prefer to use that. I've said a few things so far about the tracking form. This is what the tracking form looks like. This is a really critical piece of the interview process, so please remember to fill it out after you visit every single house, no matter if they take the survey or not. This is really important for several reasons. One, it helps us calculate the response rate. Two, it prevents us from going back to households that don't want to be surveyed. So if your team goes to a house and they tell you they're not interested in taking the survey, but we don't write that down, and the neighborhood's not closed out and another team comes, they're not going to know that you've already gone to that house. So out of respect for the people in that neighborhood, we need to write down and record when the house has been visited so we know whether or not to return. So you can see at the top, you put the date, you'll put your interview team's name, and then you'll record the cluster number. So it could be 1-1 or 1-2, whatever it is. You'll put the address, and then the status code, it comes from up at the top. So if you completed the interview, it's IC. If no one was home, it's NO. If it was refused, it was IR, not eligible, and NE, etc. You'll also have this form. This is after someone's completed the survey, you can ask if they want to sign up to receive information about the results of the survey or if they want to participate in a listening session. So this we can't do that in the tablet because then it would interfere with confidentiality of the responses. So we do it on a separate sheet of paper. So you can ask them to print their name, write their email address, and then check if they want to receive the results or if they want to participate in a listening session. If they don't, that's okay too. If they do sign up, make sure that the information that they write is legible, otherwise we won't be able to reach them. You're going to have a media release. You probably won't need to use this, but if you go to an address and they're asking a lot of questions about why we're here or if we're allowed to be here, you can pull out the media release and show them that this is an official survey that's going on, and it will also have a contact number for them to reach out to me at my office or someone else if they need more information. So that's the basics of what's included in the binder. Now I'm going to go over some of the data collection instructions that are specific to this survey. Okay, so this is just a tip. You don't have to do this, but I find that it's really helpful to park your car in a safe place and then walk the block. So if we go back here, these are neighborhood blocks, so you can see that it wouldn't be that far if you parked over here by this first the bottom left-hand dot, and then kind of walked the block and made your way back. It'll save you a little bit of time versus having to drive to every single house. So if you do that, you want to begin at the furthest point and then make your way back to your car. Remember, for safety reasons, you should never be splitting up from your partner. If you need to go back to your car, go back together. And then make every effort to close out a neighborhood before moving on. So if you look back at this point address, there's 7 addresses that are in the block. So 1, 2, 3, 4, 5, 6, 7, you can see the dots here. Those correspond to these addresses. So you want to try hard to close out the neighborhood before you move on to the next cluster, because it just makes for more efficient data collection moving forward. Okay. I mentioned a few times that you're going to be partnered up. The way that it works is one team member is going to greet the participant when you knock on the door. They're going to explain what the survey is about, and then they're going to be conducting the interview. So they're the person who's reading off of the survey script, and then team member 2 is going to be kind of standing off to the side. They're going to be recording the responses in the tablet, and the only time they're really talking is if clarification is needed. And usually what I've done in the past is you just switch off every other time so that one person's not getting really tired of talking and one person's not getting kind of overwhelmed with recording the information. So you can take turns doing each responsibility, each role, but just make sure that you know which role you're doing before you knock on the door. Okay, now this might seem a little bit like overkill to some people, but people had a lot of trouble finding and understanding how to navigate the point list last time, because it's not as simple as just going to 1206 Washington Street, for example, and then 327 Clark Street. So I'm going to walk you through, if this was your team, exactly how you would do this and what houses you would go to. So let's pretend you're cluster 7. You are going to start off at 1206 Washington Street, although you don't have to. Technically, you could start at any of these houses, but for simplicity's sake, we're going to start at the top. So 1206 Washington Street. Okay, so we're going to drive to that address. We get there, and I've circled it on the map where it's at. We knock on the door, and you can see up here the status code. Either no one was home or no one was occupying that house. So now we got to figure out what house to go to next. So we're going to go to the next closest house in the neighborhood, which is this house. So this is not on the point list. This is the tracking sheet now. I'm just writing in 1208 Washington Street. You can see 1208 was not here. I added that myself to the tracking sheet. So I wrote in 1208 Washington Street. This is still 7-1 because I never completed the interview at 1206. And this person refused. They didn't want to take the survey. So I write that down. So then I go to the next closest house, which is 1210 Washington Street. So it's still 7-1 up here. And this household does want to participate. So I write, I see the interview is completed, and I write down the household. So if you're doing a paper survey, which most people won't be doing paper surveys, but if you were, you would need to remember to write that here. So you would write, the cluster number is 7. So you're going to write that in the cluster area, and then the survey number would be 1. And that's really important for our tracking purposes. Okay, so you'd go back to your address list, you would cross that off, and then you're going to go to the next address, which is 327 Clark Street. So you're going to write this down. You're going to put 7-2, 327 Clark Street. And you got lucky on this one. This household wants to participate. So you write down interview completed. You go back to your point list, you cross that off, and you see now that the next address you should visit is 325 Clark Street. Okay, so this is where the part that people get confused on, so pay particular attention to this. So you go to 325 Clark Street, and this household refused the interview. So the next household that the next closest house is actually, you can see right here, there's a point there. That's going to be another house that was already included on our address list, but it doesn't matter because you haven't gotten 7-3 completed yet. So you're going to go to that next closest house, which happens to be 323 Clark Street. You're going to knock on the door, and you can see that this team completed that interview. They wanted to participate, but that's 7-3, not 7-4. You're going to write down 7-3, and that's what it's going to be recorded on in the tablet. So you cross that off, and now you were supposed to go to 323 Clark Street next, but you've actually already completed that. You already went there because that household participated as part of the 7-3 interview. So now you're just going to go to the next closest house, which happens to be 321 Clark Street, and they complete the interview. So 7-4, it doesn't matter that the address doesn't match. It matters that it was the closest house to this area. So that's completed. So if that is confusing to anybody, rewind this section and listen to it again. But the thing that you want to remember is that when we're going to these areas, you go to the assigned address. If they don't answer or they don't want to participate or they're not eligible, go to the next closest house and keep going to the next closest house until you complete an interview. And that's the address that you'll list for that particular point number. If that's still confusing, I can explain more in person on the day that you survey. So key thing that you should be taking away from this section is that tracking forms are very important. I mentioned earlier that we use these to calculate our response rates. It's also important because we don't want to keep visiting the same house over again if they don't want to participate in the survey, because then at that point we're harassing them. So it's out of respect to the people in the neighborhood, and it's also for our own tracking purposes that we need to write down every single house that we visit and what happens there. Okay, now I'm going to give you a quick tablet tutorial. If you were in-person training, you would do this hands-on. So if you would feel more comfortable, you can come a few minutes early on the day that you're volunteering, and I'll show you how to do this in person. But I've made a video, and I think that it'll show you at least the gist of what to do. So the first thing you do, this is not on the video, but this is how you unlock the screen. So you start at the center dot, and you're going to go over to the upper right hand corner, and then you're just going to make the square. So you make that shape, and that's how you unlock the screen. So for people with iPhones, this is an Android, and it's not a digital code. It's a shape that you draw. Okay, once you get into the tablet, I'm going to demonstrate how you record the information. Just bear with me while the video pulls up. Okay, so you're going to press collect data. This will automatically log in for you, so it would log in. Now the information's loading. You're going to click on the cluster that you're going to, click on the address that you're looking for. Now you can see it pushed up. You're going to press that address on the screen, press begin interview, and now it's going to load the form. So after it loads, and this is the Spanish version, you're going to press record time and location. That puts in the latitude, longitude, the date, time, and the cluster numbers. And then you're going to start completing the responses as the person's talking. So it's mostly drop-down menus. Here you can see I'm showing you this is a skip pattern. So based on whether or not you write yes or no, number 3 will be blurred out. And you just keep on going down. So for the check boxes, if you enter an other, it's going to give you a space to type in the person's response. If they don't say other, you won't see that other category show up. This part is, I'm going to skip this part because I didn't do a good job showing you what I'm trying to do here. Okay, so what I'm trying to show you is that there's some code in here so that if you check some boxes, but then you write in, I don't know, that's what that means, it's going to uncheck those boxes. So there's some logic built in that prevents you from selecting responses and then also selecting, I don't want to answer this question, or I don't know. So if something's happening that seems weird to you, if something's happening that seems weird to you, check to make sure that the that you're not checking a block that says, I don't know, or I don't want to answer, because that's going to erase all the other responses. So again, if you want hands-on practice, and I would suggest that you get that, please come in maybe 10 minutes or 15 minutes early on the day that you survey, and I can walk you through that process in more detail, and you can have some time to play around with it on the day that you survey. Now, just a few FAQs and we're almost done. What happens if I knock on every door in the entire block, but I haven't completed all of the interviews assigned to that cluster? So if you go to every single house in the entire block and you haven't completed all the interviews, just make a note of it. What could happen is that some of the people weren't home, so another interview team will come on a different day and try those houses again. If every single household has either taken the interview or refused it, then we just simply can't do the remaining interviews. But you don't really need to worry about that part. All you have to do is note what happened at each of the addresses and go on to the next cluster. Okay, another thing, this isn't really an FAQ, but just general information, stay in the cluster. So next closest house that you go to has to be in your cluster. That's this highlighted area that's kind of a darker orange. You can't cross the street and go into the other blocks because that's not something that was included in our random sample. So make sure that you're looking at the map and that you're within the designated area. If you find that the address that you're given is a non-residential area, so it's like a business or an office building, don't survey that location, but do kind of look around and see if there's an apartment on top of the building. Maybe that's where you're supposed to go to, but we don't survey at non-residential areas. We're only surveying households. Okay, if you find that you're going to an apartment complex and the address location is really, there's no, it doesn't say like 1901 Unit C, it just says 1901 whatever street, then you need to pick a random building, pick a random floor, and pick a random apartment to go to. So you can say, first I'm going to go to the 3rd floor, the 5th apartment on my left, or something like that. And you've already picked a random building, and you just keep doing that until you've completed all of the addresses that are assigned to that apartment complex. If you need help figuring this out, you can always call me. Okay, now we're on the last section, what to expect on the day of the survey. We're going to be meeting at East Durham Children's Initiative. It's in this St. Andrew's Baptist Church building, so you'll see this, and then there's a parking lot over to the right of the building that you can park in. Make sure that you're only parking in the parking spaces that are designated for EDCI, and there's signs, so it should be very simple to see. And please get there by 10 a.m. The address is here, and it's also in the Outlook invitations that I've sent you. Generally speaking, you're going to arrive at EDCI. I'll give you a quick briefing. I'll give you your binder and your tablet, and then shortly after 10 a.m., you and your partner will go out to your assigned neighborhood. You'll start collecting responses. When you collect your first survey response, you should text or call me to let me know that. And then you'll continue surveying from 10 a.m. to probably about 5:45-ish. You can take as many breaks as you need. We'll have already given you your lunch, so you can take a lunch break whenever you need to. And when you're about to come back, you will text or call me again to let me know that you're coming back. You'll come back to EDCI and you'll drop the materials off. And I'll make sure that the tablet's there, the charger's there. You're going to want to make sure that all the completed surveys are there. And then you can go home. You can expect, usually people complete somewhere between 5 and 10 interviews per day. A lot of that depends on the neighborhood you go to. So if you go to somewhere that's really rural, you might get 5 or maybe sometimes even less than that. If you go to somewhere that's really populated, like an apartment complex, it's a lot easier to get the interviews done and you can complete a lot faster. So checking back in, I kind of just mentioned this a little bit, but you want to try to get back no later than 6 p.m. You're going to return the tablet, the charging cord and plug, the binder that I gave you, the completed tracking forms, the completed interviews, any unused incentive bags, so that's going to be the bags with the water bottles and the information in it, and then also a mileage reimbursement form. So I will give you that before you leave, and as you're driving around, you can track where you're going, and we'll reimburse you for those miles. Another note, dress comfortably. You usually want to wear, it's going to be hot, so don't wear, I would say dress conservatively, but you can wear jeans or long shorts and then comfortable shoes because you'll be on your feet for most of the day. And we'll give you the t-shirt to change into once you get to the survey location. A note on weather. We will still survey if it rains. We will still survey if it's hot. We'll pretty much survey unless the only time we haven't surveyed is in 2016 there was a hurricane and we didn't survey on that day. But aside from something like that, we're still going to be surveying. So please come out. We still need your help even if it's hot or rainy. Just bring the appropriate gear to make you more comfortable. A quick note on lunch. I mentioned that in the morning when you pick up your supplies, you're also going to be picking up your lunch. We've never had a problem with anything going bad. Your lunch is really only going to be out for a few hours. If you come at 10 and you're probably eating around 12, but if you're worried about your food going bad or something like that, then be sure to bring your own cooler. We won't have coolers or ice to provide you with. But I would say that last time nobody had any issues, and I think you'll be fine. This is just more for your own comfort. Unfortunately, since this is a recorded webinar, I can't take questions right now, but if you have questions that I didn't answer during this webinar, please reach out to me. You can call me. My phone number is 919-560-7832, or you can email me, and you have my email address if you've received this webinar. So thank you very much for listening through the whole webinar and for volunteering with us. I really appreciate it.